If you think sleep apnea only affects people who are overweight or people who snore really loudly, then you might want to think again. There are so many other things that go into a condition like sleep apnea. Your jaw size, how your breathing patterns are, even like how you developed as a kid, like what your diet as a kid. So today I'm going to break down some of the most surprising causes of sleep apnea and other airway problems. And I'm actually going to go over some simple fixes that you can do to actually improve your sleep. So what exactly is sleep apnea and why is it a problem? So sleep apnea is when you have regular pauses in your breathing when you are sleeping. And the scary part about sleep apnea is you don't even know that your breathing is being paused. So why is this a problem? Well, when you're not breathing as well, your body is not going to get as much oxygen. That means your cells, like your organs and your brain, is not going to get as much oxygen as it needs. And also this can cause a lot of stress to your body, because when your body just stops breathing, like when you have this pause in breathing, your body's going to kind of gasp for air once it can finally breathe again. So it's like this cycle of turbulent breathing. It's not like calm, relaxed breathing. It's like stop breathing and then big inhale of breathing to get oxygen, and then eventually you stop again, and then it just keeps going back and forth like this. This can cause like a lot of stress and inflammation in your body, and this is why sleep apnea puts you at a higher risk of getting so many other diseases. Things like heart disease, cancer, Alzheimer's, diabetes, the list just goes on. But I want to focus just for another minute on the actual definition of sleep apnea, because it can get a little technical. So sleep apnea is defined as either an apnea or a hypopnea that lasts for 10 seconds or longer. So an apnea means that you actually stop breathing, if you're literally choking. And that apnea, or that pause in the breathing, has to last for at least 10 seconds for it to count as one apnea. Or you could have a hypopnea. When you have a hypopnea, you're still technically breathing, but you're really struggling to breathe. So the amount of air that you actually normally will breathe, it actually drops significantly. And this also has to last for at least 10 seconds for it to count as one hypopnea. And they usually also have to check your blood oxygen levels, and if that is dropping, that's how they kind of confirm that your actual breathing is slowing down. So when people are doing a sleep study, they'll look at how many times you're doing this throughout the night, and they'll kind of give you a grade of how severe your sleep apnea is. So there's mild, moderate, and severe. So if you have mild sleep apnea, you're gonna have like 5 to 15 of these events, of these like either apneas or these hypopneas. If you have moderate sleep apnea, now you're gonna have 15 to 30 of these all throughout the night. But very severe sleep apnea is when you have 30 or more of these. Now there is also another type of sleep apnea called central sleep apnea. That's something where like your brain does not signal your body to breathe. Now that's a whole separate other condition, and I'm not really focusing on that type of sleep apnea in this video. The vast majority of people who have sleep apnea have obstructive sleep apnea, and that's what I'm gonna focus on in this video. Now the reason I'm talking about like how many events you need for it to be like moderate sleep apnea versus severe sleep apnea, or how long that actual obstruction has to last for it to be counted as an apnea or hypopnea, is because you can still have other breathing and sleeping difficulties without it being considered sleep apnea. You see, a lot of times people just think either I have sleep apnea or I don't. And if I don't have sleep apnea, that means my sleep is great. But it's really not that simple. Like imagine if you like stop breathing for like 9 seconds throughout the night, like multiple times. But if it doesn't reach that 10-second threshold, it's not going to be counted as sleep apnea. But 9 seconds is still a long time to be like stopping your breathing. So there are other sleep disorders, or like the start of other sleep disorders, that can happen as well. And the thing is that these other sleep conditions can continue to get worse. What studies actually show is sleep apnea usually doesn't just start overnight. It's usually a condition that happens as things deteriorate or things get worse. So for instance, if at one point in your life you're struggling breathing, but it doesn't classify as sleep apnea, that condition can keep getting worse and eventually turn into sleep apnea. And that all has to do with that chronic inflammation and that chronic stress that you get when you struggle breathing. Now, with that all being said, let's get into some of the actual causes of sleep apnea. So let's start with the classic causes. Typically, we think sleep apnea comes when people have like really large neck circumferences, and that kind of compresses their airway or their breathing tubes. So this is why so many people think obesity is the main cause of sleep apnea. Because when people are obese, they have extra like tissue and like soft tissue around their neck area. And this is true, this can definitely cause sleep apnea. But even like bodybuilders have thicker neck circumferences, and bodybuilders have a higher risk of getting sleep apnea. So really anybody that has like a bigger neck circumference, like whether it's muscle or fat, is gonna be at a higher risk of getting sleep apnea. It's really just anything that will kind of weaken or kind of compress that airway. So this is why people have a higher risk as they get older, because their muscles start to get weaker. So like the muscles that normally protect the airway start to weaken, and then your airway kind of collapses a little bit. But now I kind of want to go over the more overlooked causes, like the things that people don't even talk about. One reason people get sleep apnea is because of smaller jaws. There's evidence that shows that when people have bigger faces, like bigger jaws, there's more room for their airway and their breathing tubes to develop, and they have a much harder time of getting sleep apnea. I think this one is really important to talk about because our jaw sizes have been getting smaller. Actually, ever since industrialization, our jaw sizes have rapidly gotten smaller. So for like 6,000 years ago, our ancestors all had like big, wide jaws where all their teeth would come in the right place. They didn't have a problem like with their wisdom teeth getting impacted. They didn't really have to get their wisdom teeth taken out. And ever since industrialization, our jaw sizes have rapidly been getting smaller. The main reason for this is our diet has gotten more mushy and softer. Instead of our babies eating like solid, like harder foods, our babies started eating like Gerbers and like more mushy food. And then all throughout life, like we got meat processors, we started using a fork and knife, which I'm not complaining about us using a fork and knife, but all of our foods just started getting softer and required less chewing. And the less we chew our food, the less the stem cells in our jaw get stimulated to start growing. Our ancestors used to chew food for like 4 hours out of the day. I cannot imagine chewing food for 4 hours out of the day. Like, I have so many other things to do in a day. So all this chewing will help our jaws kind of grow forward and wider, and that helps protect our airway and make more room for our airway. But the other main benefit of having a wider jaw is with our tongue. And this actually brings us to the second overlooked cause of sleep apnea, is our tongue posture. Yes, our tongue muscle is super important, not just for like licking things and like tasting things and eating, but also for how we breathe. Our ideal tongue posture should be against the roof of our mouth. Not just the tip of our tongue, but also the middle and back part of our tongue. It should kind of feel like a suction where our tongue is kind of suctioned up against the roof of our mouth. The other components of having proper oral posture is your lips should be closed and your teeth should be slightly touching. If your posture in your mouth is like this from an early age, it's also going to help stimulate the palate or the roof of your mouth to grow. And it's going to grow in the shape of your tongue because your tongue constantly resting there is going to constantly put the stimulus for that jaw to grow forward and wide. And you might think like, hey, wait, what about my mandible? Like, what about my bottom jaw? Like, how is that going to grow? Well, usually the maxilla is what restricts the mandible. So if your maxilla grows forward and wide, your mandible will follow it. But if your maxilla or your top jaw is restricted, then it's going to hold in your bottom jaw. And it has to do with how like your top teeth overlap against your bottom teeth. Like typically your top teeth will overlap over your bottom teeth. So your mandible will try to grow, but these top teeth are kind of holding in the bottom teeth and it's going to restrict that mandible. But now if your top teeth are out here, it's going to give room for that mandible to kind of grow. But the other benefit of this is when you have a wider jaw and a wider palate, there's more room for your tongue to touch the roof of your mouth. That's where your tongue should be resting. And when your tongue is resting here against the roof of the mouth, then it's not going to fall back or obstruct your breathing like in the back of the throat. But so many people, when they have smaller jaws, there's no room for their tongue to be resting against the roof of the mouth. Either that or they just never really grew up having proper tongue posture. But either way, if you grew up with your tongue like not against the roof of the mouth, then it's going to be at the floor of the mouth. And when you sleep like this, then your tongue tends to fall back and cut off your breathing. This can lead to snoring and sleep apnea because if your tongue completely falls back, it's going to completely cut off your breathing. But also without the stimulus of your tongue going against the roof of the mouth, if your tongue is always at the floor of the mouth, then your jaw does not have that stimulus to grow, so it's going to be more constricted. And this can all start from an early age. Like for example, breastfeeding will encourage the tongue to be up against the roof of the mouth because when a baby has to actually breastfeed, they actually have to work that milk out. And when they do that, it kind of trains them naturally to keep their tongue up against the roof of the mouth because they have to use their tongue against the roof of the mouth to first latch, but then they have to kind of thrust by putting their back of their tongue up against the roof of the mouth to actually get that milk out. So it's training the baby to actually have proper tongue posture. But a baby bottle will actually do the opposite. Like a baby bottle will actually push the tongue down and not encourage that proper tongue posture. And this actually brings us to the third cause of sleep apnea that's overlooked, which is mouth breathing. And you'll notice that all of these things are kind of related, like with the smaller jaws, with the tongue posture, and now the mouth breathing. Because now when your tongue is not up against the roof of the mouth, instead when it's down down, it's going to encourage your mouth to stay open. And this is kind of how our breathing patterns changed, all from industrialization. First, we started getting smaller jaws because we had more mushy foods, and then we didn't really have enough room for our tongue to be up against the roof of the mouth, and then our tongues kind of stayed against the floor of our mouth, and then our jaws started staying open, and then instead of breathing in and out of our nose like we're supposed to be doing, we started breathing in and out of our mouth. This, first of all, helped lead to more smaller jaws growing up, because when our mouth is always hanging open, our faces tend to grow in a more like elongated, narrow direction, and our teeth tend to be more crooked because there's not enough room for our teeth to come in. And instead of our tongue being up against the roof of our mouth and helping everything grow wider and forward, our cheeks are now keeping everything constricted, and there's no stimulus for our jaws to grow. The other problem with mouth breathing is you're at a much higher risk of having like snoring and sleep apnea by simply breathing in and out of your mouth versus in and out of your nose. And there's literally studies showing this. There's a study that shows that when people switch from nose breathing to mouth breathing in just one night, these healthy people suddenly developed sleep apnea. And there are plenty of other reasons that mouth breathing is bad. And I talked a lot about it in some of my other videos, so I'm gonna put a couple links in the description below if you wanna check those out. But what studies also show is that when you breathe in and out of your mouth, you don't absorb oxygen as well, so you're not gonna get as much oxygen to your cells. You're more likely to get sick because when you breathe in and out of your mouth, you're breathing this cold, dry air that's not really filtered. But when you breathe in and out of your nose, then you have these filters in your nose that kind of filter out bacteria, viruses, they kind of filter out any dust and particles. And you also produce a molecule called nitric oxide. This nitric oxide is important because it's both a vasodilator and it's an antibacterial. So it'll help keep like your whole nasopharynx area, like your back of your throat area, all clean, and it'll help dilate those blood vessels, which will improve the gas exchange in your lungs, which will help oxygen basically be delivered to all your cells even better. So there's a lot of reasons that nose breathing is better than mouth breathing. I'm not going to keep talking about it in this video because I talked about it in some of my other videos, but this kind of brings us to number 4, the fourth hidden cause of sleep apnea is nasal blockages. I know so many of you are going to be saying like, Dr. Singh, I'm always congested, or my nose is always blocked. Like, how am I supposed to breathe in and out of my nose? There's so many things that could be causing your nose to be blocked, like allergies or deviated septum, or if you have chronic like sinus infections. And this can all lead to someone just becoming a regular mouth breather. But here's the thing, part of the reason that you had all these nasal blockages is because you kind of grew up as a mouth breather. Because when people breathe in and out of their mouth, they're breathing a lot more quickly. And then when you breathe quicker, you end up losing a lot of CO2 in your body. You lose that CO2 a lot quicker. We think CO2 or carbon dioxide is this waste product, but actually when you lose too much of it, then this can be bad because your CO2 is actually really important. It's important for regulating the blood's pH. And if your pH goes off, then you can die. So your body's gonna do anything to control the CO2 levels. And one of the things your body does when you lose too much CO2 is it blocks your nose. It starts producing more mucus and all this gunk in your nose to try to slow down your breathing. You see, our bodies were literally designed to breathe in and out of our nose for our bodies to work efficiently. But when we grew up doing all these things that we weren't really supposed to be doing, then it started causing more and more issues. So the only way to start breathing in and out of your nose again is to start training your nose properly. Now I posted like an exact way to do this, like a 3-step way to basically unblock your nose and start breathing in and out of your nose again. And I don't have time to talk about it in this video, but I'm gonna put a link in the description below again, so make sure you check that one out if you wanna learn how to do that. But essentially, once you learn how to breathe in and out of your nose again, then it's gonna be a lot easier to keep breathing in and out of your nose. So my goal for this video was for you to learn that sleep apnea isn't just about your age and your weight or something that is just unavoidable. It is 100% avoidable. Well, not 100%, but a lot of times people can avoid it. Now, what can you do? Luckily, there are some simple steps. And I talked about that way to like unblock your nose, but some other things you can do are train your tongue. We talked about the proper tongue posture, like having your tongue up against the roof of your mouth. And side note, I know I talked a lot about some of my other videos, but I did make some other videos on some tongue exercises to help train your tongue to be in the right position. So make sure you check out the description below where I talked about some of those other videos too. But also, it's not just about doing these things during the day, it's also about doing it at nighttime when you're sleeping. You might wonder like, well, how am I supposed to do that when I'm sleeping? Well, there's a couple things you can do. One is use like a nasal dilator strip. There's so many different types out there, but anything that basically goes over your nose, that basically helps dilate your nose and help you breathe in and out of your nose while you're sleeping. That's gonna help prevent like any airway collapse and just help you have like continuous breathing throughout the night. And the second thing is a mouth tape. Now do this once you know that you can breathe in and out of your nose, but literally a piece of tape that goes over your lips. You don't have to get fancy with it. The one that I use is something called 3M micropore paper tape. It's literally like a medical grade tape. You rip off a piece and you tape it over your lips. Now the goal with mouth tape is so that you can still breathe in and out of your mouth if you have to, but it's basically to resist your lips from opening, because when your lips are closed and your tongue is in the right posture, then you're gonna naturally breathe in and out of your nose. But if you want, you can put that tape vertically over your lips so that you can still breathe out of like the sides of your mouth. I unfortunately can't do that because I have a beard and a mustache, so I don't wanna rip that off, so I tape it horizontally. Now some other further steps you can do are, one, going to an actual sleep doctor, because doing these kind of at-home remedies might not be enough for everyone. Some people might need a little bit extra. You can also go to an ENT, like an ear, nose, and throat doctor, and they can do like a full exam of your airway. And you can also go to someone called a myofunctional therapist. These are people that are literally trained in your tongue posture and your lip posture, and it can help train you to have better sleep, but also better posture throughout the day. Now, if you're watching this and you're concerned about your kid who might have signs of sleep apnea, then the earlier you address it, the better. So you can talk to like an ENT again, or like that same myofunctional therapist. Yes, they can still help with kids. And if your kid is really young, you can even take them to someone called a forwardontist. Now, a lot of times we think of an orthodontist, people who straighten teeth, but a forwardontist is literally someone that is trained in growing the jaws forward and wide, but also keeping the teeth straight at the same time. But in order for this to work, you have to take your child as early as possible. Now, quick side note, these are really rare to find, and it's really hard to find like a forwardontist near you. So if you cannot find one, or if your kid is a little bit older, like after the age of 8, then you might want to take them to an orthodontist. You can still take them to a forwardontist if you have one in your area, but if you can't find one, then take them to an orthodontist at least. But they can help still like expand the palate and kind of straighten out the teeth and still help a little bit. But you might want to combine this with like a myofunctional therapist to help train your kid on the proper tongue posture and everything, so that they like develop properly later on in life. And one last little thing I wanted to mention is a tongue tie. So we talked about the importance of your tongue posture, but sometimes people have a tongue tie. A tongue tie is when your tongue is literally like glued to the floor of your mouth. And this can be difficult because now you can't even touch your roof of your mouth with your tongue or do all the things with your tongue, even though you want to, or even if you have like the room for everything. And this can put you at a higher risk of sleep apnea as well. But luckily it's pretty easy to fix. You just have to get like a tongue tie release, which is like a little surgery that kind of clips the tongue and improves the freedom of the movement of the tongue. But you have to combine this with some tongue exercises to actually train the tongue to be in the right spot. If you don't do these exercises along with this tongue tie release, then the tongue tie is probably going to grow back. So the person that's doing the surgery will probably tell you about this, and you might even want to again go to that myofunctional therapist. They're going to be the best people to help with this tongue tie. Anyway, thank you guys for watching. I hope you liked that video. If you haven't already, make sure you hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. Tooth pain is the worst. I've even had patients tell me they'd rather go through pregnancy again than have a toothache. Now, obviously, I can't compare that, but before you try every remedy you see on TikTok, these are 10 of the best ways to get rid of any toothache. Hi guys, I'm Dr. Singh. I'm a licensed dentist, and while these tips can give you some temporary relief,